Then we are ready to start the first session this morning about the global threats of undernutrition and obesity. And we're very happy to have our former colleague who did his PhD with us, but he traveled now from Uganda, arriving yesterday, leaving again on Saturday. Peter, you're the first speaker in this session, so welcome.
Thank you very much, Nana. Good morning, ladies and gentlemen. I'm very glad to be back here in Oslo. Like Nana said, I'm called Peter Rukundo from Chambogo University in Kampala, and I was a former student at the PhD level here, where I did a study on the right to adequate food in the context of disaster. I was also a student at former Oslo Met, Shellel at High School Acacius. So, ladies and gentlemen, today mine is to really give the introduction, more or less, about the double burden of malnutrition. As you can see, the word impact is out, but I try to bring why a human rights lens is of the essence, because really it's very important going forward. For starters, I know many of us know what the double burden of malnutrition is, but literally it is the coexistence of the two forms of malnutrition. On one hand, the one that is more or less linked to the undernutrition, and on the other hand, overweight and obesity. So really where you have in the same household, in the same community, and even in the same country, like we are going to see, coexistence of these two forms, these extremes, that is the double burden. You'll see that in some publications currently, they even talk of the triple burden. Of course, when the micronutrient malnutrition is considered independent. But ideally, the micronutrient malnutrition is more or less the undernutrition. However, we see that these imbalances are more pronounced in lower to middle income countries. If you see many developed countries, the undernutrition issues have been more or less solved. The numbers are low. If you take Norway, for example, wouldn't say there's much stunting here, not much wasting, and perhaps not much underweight. But if you go to low-income countries like mine, you really see high levels of stunting, like I'll show you, and also an evolving problem of overweight and obesity. The numbers are surging. It's quite worrying. I know many colleagues here will talk about these numbers subsequently, but the last report from the Global Nutrition Series, we see already now 2 billion people lack key micronutrients, especially iron, folic acid, and vitamin A. So put together, close to 2 billion people actually are not accessing sufficient micronutrients. On the other hand, 155 million children under 5 years of age are stunted. And of course, if you know the effects of stunting, you're looking at the challenges with regard to cognitive development of the child, physical development, and overall human development in the country. Because we know stunted minds certainly can't plan very well when they get into the higher offices. So partly to blame is that maybe the biggest problems of the world with regard to poor leadership maybe could be linked to stunting in early age because, of course, its effects on cognitive development. 52 million children are wasted, meaning they require clinical nutrition interventions, therapeutic interventions to try and solve the problem. Otherwise, they're at a high risk of mortality. And we see that really this is a very big problem. We now call it severe acute malnutrition. And you realize that it's one of the key risk factors that leads to early mortality in children, especially in resource-limited settings. The world, like micronutrient deficiencies, is also suffering from obesity and overweight, and an estimated 2 billion people are in this category. Clearly, you can see this is also an extreme end, and if nothing is done, the overweight and obesity may surpass, actually, the undernutrition challenges. 41 million children are overweight, and therefore there's a risk of childhood obesity and the consequences of overweight and obesity in children, which among other things, of course, is early exposure to non-communicable chronic diseases like diabetes, problems with the whole skeletal system, and all the organs not working well. Of course, notwithstanding coronary heart diseases and other cardiovascular diseases. And today we see that 88% of the countries in the world are facing a double burden. This is depicted in that report from the development initiatives. And as you can see clearly, there are three, it's a Venn diagram. In the middle there, the 29 countries are suffering the three extremes, but stunting alone is affecting over 72 countries. And you can see anemia itself, a total of 125 countries are severely affected. And putting this together, it tells you that the whole world actually is affected in one way or another by malnutrition. It could be that undernutrition is low here, but if we go to the overnutrition statistics, then we shall see the countries are struggling. So actually, 88% of the countries in the world are suffering in one way or another of these two forms of malnutrition. Of course, I couldn't talk much without bringing the story from my own country, Uganda. They call it the Pearl of Africa, but it has many problems. Maybe the Pearl of Africa in terms of the weather, the climate, and etc. But when you look at the nutrition angle, really, it's not that rosy. And if you look at it here on the left-hand side, the trends in childhood undernutrition, especially stunting, wasting, and underweight. The upper line is for stunting. It has just declined to 29%, but it has been at 33 and above. Actually, as early as 1989, close to half of Ugandan children were stunted. But by the close of last year, they are 29%. So we have moved from a high stunted burden country to a medium, although the numbers are still really undesirable. But look at obesity on the other hand, and overweight. The females are really doing badly. From 2016, we see close to overweight is close to 26.5% among women of reproductive age, 15 to 49 years. But when you look at the total now, overweight is at about 18%, while obesity generally in the country is at 4%. So it's evolving. I didn't show you the slide. 6 years ago, it was at about 2%. So we see two more increments in a period of 4 years. And clearly, this burden is growing, and the challenge is getting bigger by the day. And of course, there is this slide from as early as 2013, the high-level panel of experts report, which shows that actually diet is becoming a major risk factor for most of the diseases in this world. And as you can see, if you look at this diagram very well, the risk that diet attributes to what we call DALYs, disability-adjusted life years. That's the amount of time lost amount of time lost due to disability or mortality that emerges from malnutrition or diet-related conditions. And you can see that the risk, the DALYs were close to 250,000 of DALYs lost. So we see that's a very big challenge. And from their conclusion, they say that actually malnutrition associated with diets that are not healthy represents the #1 risk factor to the global burden of disease. Meaning if you put the under together with the over, and you look at the DALYs from it, collectively, they pose the #1 risk for the global burden. And certainly, it's even overtaking or surpassing the risk of unsafe sex, which was big for HIV, AIDS, and etc., alcohol, and tobacco use. And this, many of you could have seen, there's now solid evidence linking undernutrition in early life to the development of non-communicable diseases in the later life. This has been from a number of publications, the Barker hypothesis, the Threfty phenotype hypothesis, which all point to metabolic adaptation. That at one point, if you're denied enough nutrients in utero and in early life, your cells are metabolically adapted. And when you overwhelm them in later life with a lot of exposure to heavy calories and fat, then most likely you develop non-communicable diseases. And Douglas F. has pronounced it very well, that it's easier to build strong children than to repair broken men and women. So the future is quite important. And they show you the brains of two children, one severely malnourished and the other normal. And clearly you can see the brain sizes in terms of the white matter and the gray matter differ a lot. Conclusion, finally, ladies and gentlemen, despite the progress in tackling undernutrition, overweight and obesity are still an evolving challenge. There's a lot of money in trying to prevent stunting, wasting, and underweight, especially in our developing countries. But here we see that overweight and obesity are evolving, and very soon it will be a very big problem. Human rights are weakly positioned in the efforts to promote investments in low to middle income countries. What we see now is that there's a lot of food investments coming back home in Africa and many other parts of the world. As the West gets stronger and tighter in terms of quality and safety, they are finding good ground back home in low-income countries. And then it's so difficult to fight them because then they are seen as actually a source of income and revenue for the country. So it's quite a big challenge, and the human rights debate has really been undermined. And of course, as we talk about prevention, we need to advance the right to be free from obesity. Advocacy has to come in to make sure that the consumer is protected because the forces that are coming with the food industry in terms of the lack of consumer awareness, misleading advertisements, and also a weakness in terms of absence of social marketing, really, of desirable practices. We see now that NCDs are on the increase, and clearly there's a need for energizing a movement to ensure that people are protected from this emerging problem. Litigation has not helped. From a human rights perspective, we talk about jurisprudence, creating the evidence necessary for corporations to be held to account and for government really to rise the occasion to meet its obligations in terms of respecting, protecting, and fulfilling human rights, and in this case, the right to adequate food in the context of preventing obesity and overweight. We see it has not helped because it's hard to prove these cases. Yes, McDonald's has been taken to court, and so have many others, but it's quite difficult to really win a case out of it. So to say that you to really win these cases or to use the courts of law as a deterrent is one option, but we have not fully explored it. And finally, therefore, it is important that advocacy is really heightened because we don't see a lot of advocacy in that area. And clearly, safeguarding the consumer is key. While a lot of work has been done in safeguarding the consumer on safety issues, I believe minimum work has been done on safeguarding the consumer from excess calories and excess fats and etc. So we need to take on that approach that has been used to safeguard the consumer in terms of consumer safety and health to really transform it, to look at the angle of safeguarding the consumer from excess calories and those environments which are responsible for problems linked to overweight and obesity. Ladies and gentlemen, thank you very much for listening to me.
Thank you, Peter, for setting the stage and really letting us know what it's like to be in an African country where you can really see the problems and the problems of the food industry moving in, taking the opportunity. So you already introduced that as a bit of a topic. So the next on stage is with Liv Elin Thorheim, professor in nutrition at the Oslo Metropolitan University. Still rehearsing that one. We'll talk about undernutrition.
Thank you. Good morning, everybody. We have now heard from Peter that malnutrition is still very prevalent in the world, different forms of malnutrition. And as Nana said, I will focus on undernutrition. The positive thing is that there have been agreed targets to reduce undernutrition. Through WHO, World Health Assembly, has agreed on 6 global nutrition targets. I think Kaya will touch upon afterwards. To tackle the problem, we need to understand the causes, what causes undernutrition. And this framework was developed by UNICEF. I think many of you have seen it. It has been very much used in different variations. And the framework shows causes of malnutrition at different levels. And it shows how malnutrition has many different causes, is multifactorial, and the causes at the different levels of society are interrelated. And I will go through some of the causes. And I will focus on stunting, since that is a major challenge and it is one of the malnutrition issues that is now quite high on the political agenda. It's increasing political will to try to tackle this problem. Stunting is as Peter told, is when the growth and the development of the child is hampered, is stunted. And it is actually accumulation of child deprivation over a long period of time. And even as Peter showed in this life cycle figure, it is also intergenerational accumulation of child deprivation over time. But when actually in the lifetime of a child does it occur? This figure is based on data from Malawi, and it shows that 20% of the stunting took place during, had already taken place when the child was born. So most of the children were actually born stunted, and the loss of length had already, 20% of the loss of length had taken place when the child was born. Another 20% was lost during the first 6 months. And 50% of the stunting took place between 6 months and 2 years, and then 10% the last years, up to 3 years. 3 years. So this means that to prevent stunting, one first has to make sure that the mother is healthy and well nourished before she gets pregnant, and during pregnancy and during breastfeeding. And there are several factors during pregnancy that can lead to low birth weight and stunting. Adolescent pregnancy, when the mother is very young, her need for growing and development competes with the infant's need or the fetus needs of growing. Short birth spacing is depleting the mother of nutrients. Inadequate nutrient during pregnancy, maternal anemia, and other non-nutritional factors like pollution and malaria and other infectious diseases. And then inadequate dietary intake is, of course, another very important contributor to stunting and malnutrition in children. And we know that breastfeeding is one of the most important interventions that can reduce infant mortality and undernutrition in children. And globally, only about 40% of mothers exclusively breastfeed their children the first 6 months as recommended. And breast milk gives the infants all the nutrients it needs. It contains immune factors protecting the infants against diseases. And of course, it reduces the infant to exposure to pathogens. So it is very important. And that from 6 months on, the child needs more food, and it needs food of high quality. Gradually more food to cover the increasing nutritional needs so that it can grow and develop as it should. And this is the time when most of the growth faltering takes place, as I showed earlier, 50%. So when the child starts to eat, often the food it gets in low-income setting, it's a low quality, it's a low dietary diversity, and it doesn't get fed often enough. So it doesn't manage to get enough nutrients to cover its need. And then we have the very important factor of disease, infections. There is a vicious cycle between malnutrition and infection. And infection leads to, like diarrhea, for instance, leads to reduced nutrient loss, reduced nutrient absorption, increased loss of nutrients, increased metabolism, and often reduced appetite. So the result is too little nutrients and stunting. It's actually estimated that about 50% of stunting among Indian children is due to diarrhea. So to tackle malnutrition, we have to act within the window of opportunity, which spans from conception to the child is 2 years of age. It's called the window of opportunity, 1,000 days. And this is when one has actually the opportunity to give the child the best chance, the best start in life. But as Peter also showed, there is also the life cycle. So you have to also focus on the whole lifespan of children and adolescents and mothers-to-be. So what does poverty and inequality have to do with this? Well, as Peter said, it's in particularly poor and low-income countries that have the highest level of malnutrition. And you see here, I talked mainly about inadequate dietary intake and disease, but these are caused by factors at different levels of society. Low access to food, inadequate access to food, inadequate care for children and mothers, and inadequate access to health services. And this is all related to the resources in the country and how these are governed. Corruption or good governance has a lot, it actually shows up in the nutritional situation of children, how well a country is governed. So poverty and inequality drives malnutrition to a large extent. It leads to increased household food insecurity. A poor household often has lower access to health services, often lives in more unhygienic environments. They often have lower levels of education and several other factors that leads to increased risk of malnutrition. This is an example. It shows the level of stunting among the poorest, the 20% in the different regions, and the richest 20%. So in South Asia, the level of stunting is 52% among the poorest families and 25% among the richest. So it's about twice as a high risk of being stunted in the poorest households. In Latin America, the poorest households have 4 times higher rate of stunting. So very large difference. Maternal malnutrition has been shown to be actually a strong counterforce. Mothers with education are more likely to not have stunted children. So it is a way also to counteract the malnutrition. My time is running out, but I want to just say that there are several commercial determinants of malnutrition, and Peter mentioned some, and Nanna will talk about some others. Save the Children, they recently released this report, which shows how the breast milk substitute industry are using very strong mechanisms to promote their products, and it is not allowed, but they found a way to do it anyway. And Save the Children has a campaign where you all can go in and say that the Norwegian Pension Fund should use their force to regulate, to tell these industries that they should stop promote breast milk substitutes. And it's very good business, but it is very unethical business, and it has to stop. So to end, nutrition is important, and nutrition is actually essential for the success of all the Sustainable Development Goals. Good nutrition is the foundation for human development, and it's the scaffolding for each and every of the Sustainable Development. Citation from Global Nutrition Report. Thank you.
Thank you, Liv Elin, for giving us the introduction about stunting, which is, of course, something that in Norway and the Western world we might not think so much about. But as Peter said, 155 million are actually affected globally. So it is a very important problem. So I'm the next on the speakers list. Let's see if I can get this done. And we're now turning to the food systems and the food environment to give a bit of an overview and introduction to that. Since I have a master's in food science, I think it's very nice to be able to talk a little bit about it. I will not talk so much about the specific industries, but give you more an overview and a way of thinking about it. Let's see if I can get this done. Yeah. Again, returning to the problem of overweight and obesity, this shows the overweight among the under 5-year-olds in the world. And what it shows you is actually the increase that we've seen, especially since 2000, this sharp increase. And as Peter was saying also, that it's a global problem. It's not, in the beginning we were talking about the United States, and you've seen these maps flashing of how all the children became overweight and obese in the United States. But here we can see that the number is actually growing in all countries. What we know from research is also that overweight and obesity track. It means that it tracks into adulthood, so it's a moderate tracking, meaning it's a higher risk of being overweight and obese as an adult. So prevention is the best way to prevent overweight and obesity, because treating, anybody going on a diet know this, it's very difficult to treat it. So that's part of the problem one. And then, as was mentioned also by Llewellyn, the inequalities is also there for overweight and obesity. These data are from a European project I was involved in, and it shows objectively measured overweight and obesity rates in 7 countries in Europe, showing a clear difference between the north and the south of Europe. It's well known for us in the nutrition field. For some of you, it might be a surprise that the Mediterraneans are actually the one with the highest prevalence of overweight and obesity. And in addition, the data showed in all these 7 countries, irrespective of the rate of overweight and obesity, there were educational differences, so that children of lower educated parents had a higher risk of overweight and obesity. And very rough measure, just saying, are you native Norwegian or immigrated to Norway? For all these 7 countries, again, we saw that those that were immigrants came out worse than those that were native to the countries, which indicates that there is something about the system here that causes inequalities in overweight and obesity. So keep that in mind as well. That makes us think about, I've done a lot of research on developing and evaluating school-based interventions to promote healthy eating and also to prevent overweight and obesity. But what this figure shows us that we've been mainly working on the right side of this figure on the behavioral patterns and having health promotions and actions at that end. But actually, if you want to really have an impact, you need to move upwards, upstreams, to the environments and changing the environmental drivers of the behaviors, which again causes the overweight and obesity. So that's why we need to turn to look at the environment. And of course, we know that overweight and obesity is a balance between energy in and energy out. So there's a physical activity side to this of expending energy, but we will not talk about that today. We'll talk about the nutrition side, and then you need to know the concept of nutrition transition. If you take a moment now to think about when you grew up, how food was regulated, what food were made at home, grown at home, where was it bought? I know that in the 70s when I grew up, the food stores closed at 5 o'clock in the afternoon. The gas stations sold only gas, and on Saturdays actually closed. The store actually closed at 1 o'clock, and it wasn't the food wasn't available 24/7. And I grew up on the coast. My father loves to fish. We had fish 8 days a week. And so these kind of transitions, it's been a huge change over the last 100, 200 years as we have used technology and our new knowledge and to solve the problem of undernutrition, moving us from growing foods and living of what's there right next to us, and then also having to take it when there was no good crops coming that year, there would be famines and so on, to moving into more the transition economics where we use these kind of technologies to solve the undernutrition problem, and into the modern systems that we have today where we can produce foods in one place and distribute them all over the world and eat them somewhere else, and we can store them. We have all these technologies, and that's solved the undernutrition problem, and it's given greater variety in the diet that we eat, but at the same time it's also caused the overweight and obesity to increase, and with that, the increased lifestyle diseases and non-communicable diseases, cardiovascular disease, cancers, diabetes, to increase all over with the modern system. And of course, we may then ask us, is this really where we want to move? I heard a French bureaucrat once say, we might need to redefine what's progress. You know, we progress too far, maybe we need to define it somewhere else. So these are the different food systems, keep those in mind. So what I want to make you aware of is that the high-level panel of experts on food security and nutrition then in 2015 were giving the task to provide a report on nutrition and food systems. So I want to bring that to your attention. The way they look upon the food supply system and the food environments, they presented this in this circle, where you see that the food system is about the production, the distribution, the processing and packaging, and the whole retail chain. And it could, of course, be very local, like the local farmer selling off his farm, but it could also be big business, global business. On the food environment side, we have what is more closer to the consumer, what's accessible and available to the consumer, and including also then all food safety concerns, making sure that the food is safe to eat, and the promotion and advertising and information about the food, both from the government and non-governmental organizations and from the businesses, is part of the food environment where the consumer has to find out, okay, am I buying this, am I buying that, and making their food choices. They remind us that, you know, based on if you mix this with the nutrition transition thinking, we have the traditional food systems, the mixed food systems, and the modern food systems. And where we put emphasis when we want to work with these systems might be slightly different. For instance, in the traditional food systems, food safety might still be a very important issue to think about how things are produced and kept before they get to the consumer. Whereas in the modern food systems, we see that the promotion and advertising might be the most important, might be very important to regulate. And I suppose many systems are in the mixed food systems, which means we might have to need to have a focus on many of these aspects when we work on them. And importantly, you know, across the world, the countries will be in, you know, a different group of these systems. And we need to know when we work in a country or a region, which ones of these types of food systems is the dominating one, and where do we put our focus. So, and just to stress again then, okay, this modern food system, does it really matter for overweight and obesity? And in the report, they clearly show that there is an association between a modern food system and overweight and obesity in adults. So now we've gone from the children having a high prevalence and a risk for overweight and obesity, and then in the adults we see that the modern food system. So again, maybe we need to ask ourselves, what kind of modern food system do we want to have? And they present a view of the food system as this one. And what I've realized, we've worked very much linear in simple models when I have worked on what influences dietary or food choices. And recently, I've turned to the more complex systems. And we need to actually take into account that this system is complex. On the top here, you see the drivers of the food supply system and the food environments. But in the center, you see that this shapes, again, the consumer behavior. But it's actually, I think, an interaction between the consumer behavior and the food environment and food system. And this might differ depending on, like it was said earlier, the governance and the structure around this system. So we need to put in place good systems that take care that this interaction makes sure that the environment and the consumer choice goes together to promote healthy eating rather than promote unhealthy eating and overweight and obesity.